I'm joined today by the Chief Medical Officer, Dr. Paul McMillan, Dr. Indira Martin, Director of the National Reference Lab, Dr. Danny Davis, Dr. Nakia Forbes, Dr. DeLon Brennan, and Dr. Jillian Bartlett, and Dr. Frank Bartlett from Grand Bahama. The rollout of the COVID-19 vaccine began on the 14th of March. Since then, 21,907 doses of the Oxford AstraZeneca vaccine has been administered at vaccination sites and by mobile units across New Providence, Grand Bahama, Eleuthera, and Abaco. 16,934 doses have been administered on New Providence, 3,512 on Grand Bahama, 832 on Abaco, including the Keys, and 638 on Eleuthera. During the 7 days of vaccine distribution from the 9th through the 16th of April, the team administered 9,546 doses of the vaccine for an average of 1,364 doses per day. On our best day, the 14th of April, 1,546 doses were administered. This week, we are offering 4,000 appointments to the public via the vax.gov.bs portal. Appointments are available at the Kendall Isaacs Gym, Loyola Hall, Pilgrim Baptist Church, Church of God of Prophecy, and St. Anselm's Church beginning on Thursday of this week. Most of the sites are open 9 a.m. to 3 p.m. The Kendall Isaacs Gym site is open from 2 p.m. to 6 p.m. There are generally two types of vaccination centers in this operation. The large centers have the capacity to administer approximately 500 doses daily. These sites were chosen based on the size of the venue, ease of access, traffic flow, and parking, and are typically appointment-only sites. The community vaccine centers are characterized by their proximity to high-density population areas, access to bus routes, and pedestrian traffic. These centers are set up to accommodate walk-up clients who may not have access to the internet to make an appointment online. The vaccination centers were initially operating Monday to Saturday, but as we expanded the schedule, it was changed to Monday to Friday. Mobile units are being used to reach resident facilities and the homebound with physical disabilities. The large centers are focused on throughput and efficiency, while the community sites ensure greater access to many. As we are all aware, the distribution of the COVID-19 vaccine across the archipelago is the most challenging logistical exercise faced by the public health sector in this country's history. The success of the distribution to date is attributed to many healthcare providers and volunteers, Rotarians, Kiwanis, Red Cross, and many individuals have come forward to help with this critical national initiative. We sincerely thank them for their time and commitment. We are also indebted to the organizations that have allowed us to use their facilities, and most of all to the general public for their cooperation. I say to you, citizens and residents, we are in a race against time. The pandemic is not over. COVID-19 is continuously presenting new challenges. And at this time, vaccinations alone will not get us out of this pandemic. We must simultaneously address the increase in cases, the identification of resistant strains, and adherence to the public health measures if we are to win this race and return to a sense of normalcy. As we seek to increase access to the COVID-19 vaccine and the number of vaccinations administered, we have been observing an increase in case numbers on a daily basis over the last 2 weeks. Although yesterday, on the Monday, we recorded 9 new confirmed cases. May I have the slide 2, please? Of that number, 8 were recorded in New Providence and 1 on the island of Bimini. And you would see the cumulative increase in cases. This is all Bahamas, then in New Providence. Next slide, please. Grand Bahama. And you see that line going almost up vertically. And Abaco. And you see there may be a beginning towards a plateau in the Abaco. Next slide, please. You see the hospitalizations that are occurring. It's beginning to take that upward trend. Mercifully, the ICU is still not following the hospitalization, the upward trajectory of the cases. Okay. Next slide, please. This is a busy slide, but I introduced this slide to show you that the epidemiological profile is changing. If you look to and this is the age distribution of deaths due to COVID-19 in the Bahamas. If you look at the beginning of our surge, and if you track the gray bar, it is higher than the orange bar. And as you come now to the present situation, you see, and this is age, the older ages are in gray, and the orange is for the younger population. So you see, as we are now in the March-April time, you see there's equal distribution, it appears, but what it represents is that the mortality is certainly to the left now of that age group that is presented in the gray. Next slide, please. The death breakdown is particularly of note when you look at this presented here, and you look at the 40 and above. And of note is also the male-female distribution of that case. Next slide, please. This, as we said, travel plays a part. The increase in cases is related to travel. And this slide graphically represents the blue, the increase of weekly international travel, and the cumulative projection of the line. So new infections are being driven by international travel and a relaxed adherence to the health guidelines. The emergence of variant strains of COVID-19 is of significant concern. New strains have been identified from, you're well aware, the United Kingdom, Brazil, and South Africa, and most recently from India. These variants spread more easily and are infecting younger age groups. The cases may be more severe, and some countries are reporting more deaths. We have been actively monitoring genomic testing from the 13th of March to the 17th of April. Next slide, please. And these are the trends in detection in the samples. This is work done by the reference lab and Dr. Martin. And there is evidence of an increasing number of genomic deletions, which means that this is indicative of variant strains. Can we go to the next slide, which is most concerning when we look at the detection of these deletions by island. And although Grand Bahama presented with a lot of cases, the deletion of the strain in Grand Bahama was only identified last week. But you see, in many of our territories, and look at the Royal Bahamas Defense Force, the deletions are occurring in the orange bar. So you have the number, 120 samples was surveilled. And the bar shows where they're detected. Now, go back for me to the other slide, and it shows that the percentage of these variants is increasing. If you look at this slide, the blue number of samples surveilled, and if you look at the gray on this bar, it gives you the percentage increasing with these samples. And further questions will be, or if you need further details, we would ask Dr. Martin to respond to them. So, ladies and gentlemen, citizens, residents, we must return to heightened surveillance and also contact tracing if we are going to win this race in the shortest period of time. We must test, we must isolate, we must trace, we must treat, and we must vaccinate. The COVID-19 vaccine provides you with the opportunity to develop an immune response to combat this infection. The immune response will neutralize the severity of the COVID-19 virus infection. There may be side effects from the vaccine, but these side effects have not shown to be life-threatening. The monitoring of all adverse events through the events supposedly attributable to vaccination or immunization, the ISAVI model, we call ISAVI, that system is ongoing. And this provides for the documentation of adverse events following vaccination. To date, of all the doses given, there have been no hospitalizations or deaths recorded due to the COVID virus in vaccinated individuals. Following vaccination, the immune response builds up over a 90-day period on average, and during this time, the individual may become infected with the COVID-19 virus, but is unlikely to have severe disease. While infected, you may also transmit the virus. For this AstraZeneca COVID-19 vaccine, it is recommended that the second dose be given 8 to 12 weeks after the first dose. We are in the beginning of a surge, and to control the surge in new cases, I repeat, we must test, isolate, trace, treat, and vaccinate. Contact tracing is being stepped up on New Providence, Grand Bahama, and Family Islands. All cases and contacts of cases must be identified to bring the spread of COVID-19 under control. As part of the contact tracing process, Private labs reporting requirements are also being enforced to ensure that information reaches health officials in a complete, accurate, timely manner. At the same time, we are moving to accelerate the vaccination program throughout the Bahamas. We want to commend the work of the local teams on the ground in Grand Bahama, Eleuthera, and Abaco, and most of all, the public for their cooperation with this vaccine initiative. Given the diversity of the Family Islands, we hope to incorporate those lessons learned in the early phases of this rollout. And at this time, final preparations are underway for the full rollout of the vaccine program in all of the Family Islands. Next, health and logistics team were deployed this morning to start carrying out reconnaissance visits in preparation for the start of vaccinations in the islands during the week of the 26th of April. Health teams will be supported by local government officials, health administrators, and community leaders. These teams will prepare the vaccination sites, secure the necessary supplies, and conduct training for the online platform. It is ambitious, as you see in that chart, and we hope this will be completed over a 3-day period. In the Family Islands, the vaccination component of the program will be administered to all residents 18 years and older who provide a Bahamian government ID in line with the following proposed schedule. And if we go to the vaccine rollout map, Andros, Maguana, Inagua, Crooked Island, May 26, together with Long Key will go to Acklands, North Central and South Andros, Ragged Island, and mainland Exuma. On Tuesday, the Berry Islands, Great Harbor Key, Cat Island, San Salvador, and Long Island, Exuma Keys, and Rum Key. Wednesdays, North Central and South Eleuthera. And on Friday, we have Bimini. Now, this is overly ambitious. It's necessary to attempt it, and we are optimistic that we will be successful. We are grateful to the United States Embassy. They're providing transportation services, the Royal Bahamas Defense Force, the Royal Bahamas Police Force, Odyssey Aviation, and Air Flight Services. They will assist with air transportation of the health and logistics team and the vaccines to and from the Family Islands during the course of the rollout. The location of vaccination sites, days, and times for each island will be published on opm.gov.bs and would be widely circulated. Online and on-site appointments would be available at all Family Island locations. We're appealing to the Family Island residents to make their appointments online at vax.gov.bs. If you are unable to make an appointment online, and if you are unable to ask a family member or friend for help, online appointments would be provided at the site. However, the online appointment process cuts down on wait times and promotes a more efficient system. Please stay tuned for updates related to the Family Island rollout via ZNS, TV and radio, your local government office, and the Office of the Prime Minister's and Ministry of Health websites, and of course, social media platforms. Vaccination centers on New Providence and Grand Bahama will remain open during the Family Island rollout. We are pleased to report that the Bahamas has been informed by the Pan American Health Organization that it will receive the second tranche of the AstraZeneca vaccines through the COVAX facility before the end of May. This tranche will consist of 33,000 doses. This leaves a remaining 34,200 doses to be received through the COVAX facility. The AstraZeneca COVID-19 vaccine is a 2-dose regimen, and we are committed to it. The administration of the second dose of this vaccine will begin on the 10th of May. You will receive an email notification of your scheduled time to receive the second dose. Once you are notified, you should make your appointment online at vax.gov.bs. Please wait until you have received your notification to make your appointment. As mentioned earlier, an 8 to 12-week period is recommended between the first and second doses. If you did not make an appointment online, present your yellow vaccination card to the vaccination center where you received your first dose to make an on-site appointment. Upon full vaccination, you will receive an electronic certificate with a QR code. For residents unable to access an electronic certificate, please contact the nearest public health clinic and efforts would be made for you to receive a copy of the certificate. I repeat that vaccination is a critical element in controlling the spread of COVID-19 and bringing an end to the pandemic. We are making progress, but our work is far from over. To help slow the spread of vaccine, we must redouble our efforts. This is no time to relax. We must continue to practice the public health measures. Avoid large gatherings. Abide by the emergency orders. Wear your mask properly over your nose and your mouth. Keep a distance of 6 feet from others when you are out. Wash and sanitize your hands regularly. And when you are eligible, get vaccinated. The sooner we get vaccinated, the sooner we can fully open our economy. The sooner we get vaccinated, the sooner we can get back to work. The sooner we get vaccinated, the sooner we can get back to enjoying the activities we love, like Dunkadoo. I say to you, each one help one, and together we will get through this pandemic. The Ministry of Health officials and the Consultative Committee will continue to provide regular updates on the distribution of the COVID-19 vaccine. We encourage the public to use the Ministries of Health and the Office of the Prime Minister's official websites and social platforms and credible news sources to keep up to date and properly informed about the COVID-19 vaccine. I wish to thank each and every one who has made the distribution of the vaccine to date a success. I'm happy to take questions from the media at this time. Good afternoon. Can we begin with Matthew Moxie, please?
workplaces requiring employees to take the vaccine.
Do you mind repeating that? I only heard a part of it. Please repeat your question.
Yes, what is the committee's position on workplaces requiring employees to take the vaccine?
Uh, the committee's position is that of the government's position, supports the government position, that is, it's not mandatory. You must elect to take the vaccine. The issues related to your employment is between you and the employer. Do you have another question? Keishla Adley, please.
Yes, good afternoon, everyone. Dr. Dalregis, you referred to the fact that efforts to manage this pandemic have been compounded by the additional cases of vaccination program that's ongoing, et cetera. You also mentioned that you will step up the contact tracing and other protocols to sort of manage things and keep them under control. There's been a lot of speculation about whether these controls will once again mean the restricted movement, curfews, et cetera. Can you answer if that may be the case?
I'm afraid that resides with the competent authority. But our recommendations are that we do have restrictions. You've seen the impact of international travel. We reached a stage that our contact tracing wasn't as required. The cases were so few that it wasn't necessary to accelerate the contact tracing until now we're in the surge. And we have called back all of those persons who helped us bring the pandemic to under 10 new cases a day to come back and help us. So we're in that process. We're thinking, Ms. Adderley, that if we, as I say, this is a race. If we vaccinate many people, at the same time we accelerate the contact tracing and we practice the public health measures, we are optimistic, or we're hoping that we would see a plateau effect, that we'd begin in a short period of time to see the hospitalizations either leveling off or decreasing. And if we see that, and the restrictive measures that we currently have need to be strongly enforced, and we can move ahead with this. Tanya Cartwright, please.
Good afternoon, Dr. Dalregis. You seem to have put out a good schedule of a rollout of vaccines. Now we are in this third wave, we might as well say. Would you consider at any point increasing the vaccinations in light of the third wave?
We would very much like to do that, and we've been told that we are overly ambitious. The success in the Abacos, the team says that they had very little sleep. They traveled long hours. They vaccinated many people, and that was over a 5-day period. We did Abaco and the Keys. The proposed plan for the Family Island rollout, and we're going to use many teams, but it appears that we may be taxing the human resource capacities that we have, but they're willing to try, and that's our attempt at accelerating the vaccine program in the Family Islands. When we come to New Providence, we're going to do our best to keep the sites open with the staff that we currently have. We all also welcome any volunteers, any retired persons. You're more than welcome to help with this proposed acceleration, or the acceleration that Ms. Cartwright wants us to do. We welcome each and all of you to help us out. And just let us know, and we'll be train you. We have virtual training, and we can certainly do what we can with more people. Thank you. Madame Jasper Ward.
Hello, Dr. Regis. It's been a while.
Uh,
You noted that there is evidence of an increasing number of genomic deletions, which in your words means that this is indicative of variant strains. For us basic folks who didn't go to med school, are you saying that we have the variants of concern here in the Bahamas, that the Ministry of Health has detected that?
Yes, it indicates that. And if you need more information, I would ask Dr. Martin. If you have another part of that question, although this is screening, this is strongly indicative. But would you like Dr. Martin to respond?
Yes, please.
Dr. Martin.
Good afternoon, everybody. Thank you, Ms. Ward, for the question. So as Dr. Dalby just said, it is indicative. It's a proxy for genomic sequencing, because what we're looking for using this PCR approach is for a specific mutation, a deletion in the genome that has occurred specifically and independently in the 3 variants of concern that are out there right now. And it also distinguishes those 3 variants from the original strain of COVID. So by looking for this deletion over time, we've also seen, yes, that it's increased over time, which again is another, I guess, indication of the validity of the results. The final confirmation for us will be when we get back the CARFA samples. We sent 10 CARFA samples off at the beginning of March, which happens to be around the time when it appears, based on the trend data, that these variants may have come into the country and kind of expanded. So, but once we get the sequencing data from those 10 samples back, that will tell us, number one, it'll help to confirm our approach internally, although we're pretty confident because it's being used ubiquitously throughout the world. So it will confirm our approach. And secondly, it will also tell us which of the 3 variants of concern is in country, or it might be more than one, who knows. But that's going to be important also in terms of the ramifications of this data. From a pragmatic perspective, all 3 of the variants have an increased transmissibility. But as you get into the weeds of it, there's differences, specific differences between each of the variants in terms of their responsiveness to particular vaccines and so on and so forth. So I hope that answers the question. Thank you.
Tyler Simonet, please.
Good afternoon, Dr. Dalregis, and to the other health officials. My first question is, has the vaccine consultative committee given any consideration to trying to obtain another kind of vaccine besides AstraZeneca, such as the Pfizer or Moderna, and making that available to the Bahamian public?
Yes. All efforts are being made to access the vaccine, the other options. We've made direct contact. The Pfizer vaccine requires ultra-cold storage, and that is not available, particularly in our archipelago. The Moderna directly told us we could put in an order for 2022. And Johnson & Johnson, that's currently available, said that they don't have they don't have the supplies. But given that the COVAX facility, we benefited from the COVAX facility, we could not be in their queue to receive Johnson & Johnson vaccines. Okay. Shamanko Lightburn, please.
Hi, good afternoon, Dr. Dalregis. Good to have you with us. With Family Island rollout beginning next week, is there a cap amount on the number of vaccines being sent out to each family island, or is the scheduled reconnaissance of the health officials in preparation of the rollout going to determine how much each island receives?
We used different formulae. Yes, the reconnaissance would give us an idea of the appointment and what the uptake would be. But we'll send more than enough vaccines in that we've calculated the population. Now, recognizing that we use census data and we use local reports, and we send out a percentage of that vaccine because of security issues. And we want to secure the viability of the vaccine as well. But if you look at our plans, Shamarko, you would see that there are teams and drop-offs, so that if we'd love to have them run out of vaccines, there's an opportunity to go back in that routing to deliver more vaccines. But we intend to have more than what we have calculated for the population, given that we are guaranteed the protection of the vaccine and the security of the vaccine, and that we have been assured. Gillian Gray, please.
Hello. Dr. Dalregis, you would have said that the spike in cases is due to international travel. Can you, and this is a multifaceted question, can you say, based on your tracing, if there is community spread or any clusters that you can identify, and also have those travelers been to areas where these more infectious strains have been, and have those samples been sent off as yet?
Could you ask all three parts of your question, please? Is that the full question, or do you have different parts?
So that was the full question about if there were any clusters or community spread that you would have noticed because of the international travel spike in cases, and also have these travelers been to more infectious areas where more infectious strains have been identified, and have their samples been sent off?
I'm going to ask the Chief Medical Officer if do you wish to respond to that? I got permission to proceed. Yes, they have traveled to international destinations where you have those strains. That's the first thing, and most of them, those strains, as you are aware, exist in 50 or more states of the United States of America. And most of our travel has been to the United States. When we look at the contact tracing, as we look for the clusters, and as you say, they're travel related, that work is ongoing. And I'm hoping that at your next press conference, they'd be able to give you details of the various clusters. But as I understand it, we're not saying that there's community spread at this time. We do think that this is related to households and clusters. But we have to confirm that with our particular software that we are using. I hope, Ms. Gray, that is helpful to you. Rustin Jones, please. Mr. Jones?
Forgive me, I was muted for a second there. Good afternoon, Dr. Dalredis.
Good afternoon, sir.
Thank you. Given that the increase in cases is largely attributed to international travel, is there a mind to ease restrictions for domestic travel, for example? And is there a consideration to adjusting the travel regime and maybe introducing vaccination as a requirement for travel in the future?
That's a multi-part question. The first part, it is not only due to international travel. Let me disavow you of that. It's a combination of many factors, and some of it is due to relaxation of the behaviors that we were using That's what's been reported to us. That the parties, the social gatherings, the mask wearing at these gatherings are all contributing to this spread. So it's not only international travel. You had a second part of a question, Mr. Jones?
I did, thank you. And thanks for the response. Just seeing if the committee is reviewing or considering introducing things like a requirement for vaccination to travel internationally at some point. Has that conversation come up?
Oh, it is everywhere, is it not? The competent authority will announce the various revisions or changes to the policy for travel. But Mr. Jones, if you are fully vaccinated and you see what is going on, the CDC guidelines for their domestic travel, 2 weeks after you're fully vaccinated, you're not required to do any testing, and you can move freely within states. We are looking at all of the options, given that we are an archipelago, and some of our islands have gone almost 200 days without a case of COVID. And should someone be fully vaccinated, that policy is being considered and discussed. And in a short time, as we approach the second dose vaccination, the competent authority would unveil whatever the new policy is. But it's certainly been discussed. Yeah, Mr. Jones, I'm told that you are to ask us if you wish to ask a second question, I should receive it.
Thank you very much for that. The second question for me would be, for what we understand, the second dose of the vaccine has or is being reserved for recipients of the first dose. I may have to confirm that. But if that's the case, then how many more doses can the committee administer? Based on some basic math, I guess that figure might be near 27,000 or so. But what would be the safe stopping point to stop vaccinations locally if we're going to reserve that second dose for recipients of the first dose?
Yeah, we are committed to the second dose. And if you recall, we had 20,000, that gift from India. We still want to express our appreciation for that. We had 33,600. So we've delivered 21,900, say 22,000. We know that if you divide the 53,600 doses in two, you are fast approaching your critical level for vaccination. But we are really fortunate in that we're expecting another 33,000 within the coming week or 2 weeks. And that changes our calculation because all the vaccines have expiry dates that we must be mindful of. And so we recalculate. So if you are at 25,000 plus or 26,000 by the end in another week or so, and the other group of vaccines come, you then can vaccinate 16,000 of those before you get the commitment of another tranche. As I mentioned to you, we're expecting another 34,000. If both come together, we'll be able to extend to more than 30,000 persons to receive the vaccine, first and second dose. Okay, Ms. Gray, Jillian Gray, please. Your second question.
Hello again.
Uh-huh.
Thank you so much. At last report, I believe it was about 60% of healthcare professionals who were hesitant to take the vaccine. Speaking with some of those medical unions yesterday, they said that they were still hesitant, and some said that it was basically because there has been very little partnership with getting information, getting their questions answered, and things like that. Can you just speak to that and what, if anything, you're doing to get more medical professionals to take the vaccine?
The consultative committee will welcome any opportunity to share knowledge and expertise with those groups. They just have to ask, and it will be accommodated. Okay, Shamarko Leibman, please.
Thank you, Dr. Dalregis. So my second question is more of a social inquiry. In the data that the ministry has gathered so far, have you been able to do a comparative analysis on whether family islanders, meaning the islands with current rollouts, are more or less inclined to take the vaccine than their city counterparts?
Yes, just from the feedback that we've gotten, we haven't analyzed all the data, but from the feedback we get from the Abacos and Eleuthera, North Eleuthera in particular, that there is a great interest in taking the vaccine. Oh, Tyler Simonet, please. They have me going reverse order. Okay, yes. Sorry.
Hello again. My second question is in regards to the cruise industry, which is set to return to the Bahamas in the coming summer months, I believe in July or June. I want to know, were health officials consulted at all by the Ministry of Tourism about the cruise industry returning? And what are some of the concerns that health officials have in regards to this?
There is ongoing discussion at many levels of government with matters that relate to tourism, the economy, etc. The concern we have is that the requirement, we must get these rates, the new cases, down, because there's an advisory that came out that was not favorable. So from CDC, and they closely watch the new cases, the hospitalizations, and they're also monitoring the vaccine uptake. If we can stem the tide of the new cases, we can accelerate the vaccination, and it's May. We think that we would put ourselves in a position to receive a favorable response that promotes the Bahamas as a destination for tourists. So it's important that all those hospitality groups that they protect themselves, and they also work with the government to facilitate increased tourist travels to the Bahamas. Jasper Ward, please.
Hello, Doc. My second question, now that you guys have acknowledged variants of concerns being present in the Bahamas, I would note that Dr. Martin said that it would take some further studies to determine which of the three variants are actually present in the Bahamas. But any concern about the impact, the effect of the AstraZeneca vaccine on the variants, especially if it is confirmed that we have the South African variant, which we know the AstraZeneca vaccine is not very effective on? What will be the next step, and any concerns if we have the South African variant? If that's correct.
That's an excellent question. Can I ask Dr. Martin to, because we would look to her for sensitivities to these strains. Dr. Martin, please. Or anyone who's on the Zoom would like to answer that question?
Good afternoon, everyone. I can answer that question.
Go ahead.
So, as it relates to the South African variant, we know that the AstraZeneca vaccine is partially effective. It's about 60% effective. But what's important to know is that even though persons can still get mild COVID symptoms, because of breakthrough with that variant and that vaccine will still protect from severe cases and hospitalizations and deaths. So there is somewhat of a silver lining in that regard. But it would be important for us to continue to look at procuring other vaccines.
Thank you very much. Tanya Cartwright, please.
Dr. Dalrigis, given the tightness on vaccines worldwide, is it wise to run a vigorous campaign on first jabs or hold off and use what you have for your second jabs that are probably now due?
Thank you for that question, because I think it's important to repeat what I've said in the conference. We are committed to 2-dose vaccine schedule, and we are prepared to, given the uptake, I do not think we're going to run out of second dose options. When Mr. Jones asked about the calculations, these calculations are ongoing, but we do, as a committee, commit to recommending the second dose. Although, Ms. Cartwright, it's a very good question, because as the science is published, we are pleased to learn that the efficacy of the AstraZeneca has increased 81% in some studies. So you're protected even with the first dose, but we are hoping that we are able to give the booster dose based on our calculations and the commitment of the supplies. We've gotten the commitment already. We just have to receive the supplies. Keishla Adley, please.
Yes, good afternoon again. I heard an international report this morning, which must admit, I'm not 100% sure of the context, whether it was statewide or nationwide, about a 20% new case statistic where children were involved. We, of course, had a concern this week about cases in school. I'm just wondering if there's anything to indicate that children may be more susceptible than they have been in the past.
We're looking at the data, and one of the slides I showed you, we have cases, we look at the shift to the left in the ages, and we had a younger population. So this is something that has to be monitored very carefully. And yes, we have to be aware that this COVID is full of surprise, filled with twists and turns and surprises, and we're learning as we go. The script is not written, the textbooks are not available. Oh, Matthew Moxie, you have the last question, sir.
Thank you. So I took note of your slide with the distribution of COVID-19 cases with reported international travel history. Do we have any data on domestic travel related cases?
Yes, if you go back to the slide, not the one with the graph ascending. I don't know if they can go back to the island slide where, again, I was looking at the variants when we was doing surveillance. But probably anyone on the call can, where these was surveillance of the percentage of islands surveilled based on the positive cases. And is that not so, Dr. McMillan? He's asking the question about the international travel and the comparison with the domestic travel and the detection of variants. Is that your question? Matthew Moxie, do you want to restate your question, please?
Yes, I'm just asking about, I saw the slide with the number of travel-related cases that we had internationally, but I don't think I saw any with the domestic travel-related cases.
The inter-island travel. No, we don't have that information. I don't have that information in my slide deck. I don't know if anyone on the call can speak to it. No. The closest proxy is the island surveilled, Mr. Moxie, but we can certainly look into that. I wish to thank each of you for your questions. That concludes our press conference of today. Until, goodbye.